everyone, and welcome to Methylomic Matters, the podcast in which we discuss all kinds of matters regarding the Methylomic Project, a large European research project aimed at enhancing the effectiveness of the medication in chronic diseases such as Crohn's disease, rheumatoid arthritis, and psoriasis. And in this episode, we focus on the clinical trial called OmiCrohn and how it might impact the lives of people with Crohn's disease. And my guests today are Luisa Avedano, the CEO of the EFCA, which is the short for the European Federation of Crohn's and Ulcerative Colitis Associations, and Roberto Saldaña, who is in charge of innovation and patient engagement. Welcome, both of you. The EFCA represents 46 national inflammatory bowel disease patient associations. So IBD, inflammatory bowel disease. And you're committed to improving the life of over 10 million people living with IBD worldwide and 3.4 million in Europe alone, which are enormous numbers. Well, we have been discussing the Methylomic trials, and mostly in this context, the OmiCrohn trial. Can you explain to us how important is this research for people with Crohn's?
What was really convincing us was the innovative aspect of this project. To be honest, we didn't have the full picture of the scientific side, but from one side, the fact that our Dutch member was facilitating the exchange, that was a good starting point, and the other side that we realized that the project was a really innovative one, we decided to be part of it. And there was another option, and then I leave this part to Roberto. We are now investing a lot as EFCA in clinical trials, or better, in the role that patients can play since the very beginning of the trial. So co-designing the trial, defining the attributes, etc. For these reasons, since the starting point of this project, at least when it comes to IBD, was the OmiCrohn trial, we decided it could have been also for us a good testing phase for what we are doing in general terms on clinical trials, of course, from the patient side. Roberto?
And from a practical perspective, IBD is a complex condition. It's unpredictable. Taking into account that there are several drugs in the market, but IBD, and also taking into account that every IBD is unique, it has been hard to get some treatment and care, just like if we were all the same patient with the same condition, the same characteristics, because it's not true. Now this trial brings us some hope, because if we can predict what is unpredictable, we are going to better treat patients from now on.
And improve the quality of life.
Yeah, we are going to avoid suffering. We are going to accelerate the how we are getting into remission. So this is part of the advantage of this trial and what we are going to get if we are successful. So predict success is always a good thing.
Yeah, because as you said, every Crohn's disease or every IBD is a different disease.
Yep.
It's very individual, and so getting the right medication is also every time a challenge. And this OmiCrohn trial might help better predict and therefore help patients.
Going to help us to make better decisions.
Yes.
Because it's so hard to make a decision of what treatment to use and when, or who are maybe the best candidates for the proper treatment. Without any information. We are making decisions
based on
without any context. So if we can decide according to what treatment are going to fit better to our case, it's going to be amazing. Because we are going to avoid side effects when there is no any opportunity to get advantage of the treatment, because we are going to refuse those treatments from now on if we are successful.
So less side effects as well. Can you explain a bit what is the impact of Crohn's on patient lives?
There are many symptoms that are always affecting us. pain, abdominal pain, joint pains, we have diarrhea, the urgency to go to the toilet, we have blood in our stools, we are suffering fatigue, we are always with a low level of energy, depression. There are many symptoms in different dimensions, physical symptoms and also mental symptoms. And they are annoying because you can control it. You can predict it, so you can anticipate when they are going to occur, how can you deal with them, and how you can even mitigate them.
Yeah. So seeing this, taking this into account, that this research might better predict and help you get a better quality of life. So can you explain, seeing that this disease is very unpredictable, what is the added value of this research when looking at Crohn's disease?
Most of the patients currently are experiencing symptoms. Some of us are in deep remission, but most of them are experiencing symptoms in their daily life. Some of us maybe we are experiencing symptoms from time to time. It's okay, but sometimes what is happening is that we are getting the proper treatment, but without optimizing the doses. For example, the doses, the frequency. If we can understand what kind of subtype of IBD we have, and we can optimize the doses, the symptoms are going to disappear.
Yes.
That is what this trial is
so it's very hopeful.
Offering to us.
It's hopeful.
Optimized treatment, identifying better what is our IBD. It is going to help us to identify our IBD. The subtype of IBD is going to help us to monitor better the condition, to reduce the symptoms, or even to get to help you to get into deep remission. Yeah.
And so this study is
or if you need to change the treatment, it's going to suggest you which one is the best option.
Yeah. So it can really help choose which treatment works the best and really improve quality of life.
It's going to change and improve clinical practice forever.
Forever, yeah. And what do you expect from the study itself? What do you expect that it will show or do?
Well, but in general terms, we hope that we will be able to define better at least some of the IBD subtypes, so to better support the clinical choices, and as a consequence, in this case, I think that the methylomic is the clear example of how we can unite it, so patient, industry, and above all researchers, we can really find the optimized balance between care and quality of life, quality of care and quality of life, because in this case they're really very much intermixed. And also, I personally think that dealing with quality of life and quality of care in this way could also be very important in terms of money saving, because we know that many patients are changing drugs simply because either they are no longer effective or they have a lot of adverse effects, so you are obliged to stop. Maybe have a period in which you don't take anything, and then you start with a new one, and then again you start from below zero, trying to understand which is the best dose, etc.
So the trialing is for patients itself. It's also expensive because of the medication we have to use, but maybe people aren't able to work for a while.
Or
all kinds of costs.
Yeah.
Do you think this will provide a breakthrough? Are you optimistic enough to say it would be a breakthrough?
I would say, let's see. In the sense that what as patient community we want to avoid to give false expectations to our community. We are also partner in another important innovative project that is working on different type of administration of drugs. We know that is very promising, but we don't want to promise our community, let's say in 5 years we will be able to at least not identify everything, because no one is a magician, but we don't want to create false expectations. So it's very promising, particularly when it comes to more personalized medicine, identification of subtypes, and better quality of care and life. But we are in an early stage. I think that after 2 years and something is too early to say. I think we are in the right direction, but maybe in 2 years, if we sit here again, we can have more.
You can roll out the flags.
Yeah, exactly. Yeah. Roberto, you want to add something?
Evidence is promising. It's the only thing I can say now.
Yeah, you're hopeful that it will help.
Yes. We need it.
You need it, yes, exactly. It's a European project. How will we roll out the treatments in all countries, or how will we roll out the outcomes in all countries?
Well, this is more for a CEO's answer, no?
Yeah.
Serious answer. Let's hear a serious answer.
No, CEO. Sorry.
CEO. Sorry.
No, CEO. Sorry. No.
Yeah.
Because I mean, there again, it's a way to organize our work. We have at the moment, if I'm not wrong, 7 countries that have been that are the target of the trials. So we have of course the Netherlands, we have Italy, we have the 2 Belgian members, because in Belgium we have 2 members because we have 2 languages, so the Flemish and the French one. Then we have Hungary, and then we have Slovenia.
And Portugal, right?
And no, Portugal not. No.
England, United
UK,
Kingdom, yeah.
UK, yes. And usually we try to, first of all, inform the community in general. So all our members are aware of the project, and which are in a very easy way the deliverable, the steps, and etc. Then, in particular, with those countries that are directly targeted in the trial, we have a more personalized type of communication.
So, in the countries where the trial is actively put out, there's an active communication.
Different way to communicate with our members.
Yeah.
And then there is this not last but not least is not the exception, but is the the inspiring practice. The Dutch Association, our member, is working in partnership with us in some parts of the communication. So, for instance, we are here coordinated by our Dutch member that is in charge of delivering the podcasts. And generally speaking, when it comes to the other countries that are members, we try to inform them about the trials, about the criteria, about everything we have available. And I think the most important part, and the podcasts are already part of this big package of communication and dissemination, what we really want to do is not only inform our members at the beginning or in the interim phase. For us, it's of paramount importance to inform our members of the outcomes. So hopefully in 3 years or so, we will be able to tell first to those who have been participating in the trials, but in general to all our members the results.
Yeah.
And this is very important, because one of the limits of clinical trial is that when patients are enrolled, they are barely informed about the starting point, but very rarely they receive the final feedback. And this is why we are very proud to be an association of patients, because one of our tasks is to keep our community informed from the very beginning, since the very end. Yeah. No matter if it is successful or not. The important is that those who have been involved have to know what has happened and what is going to happen.
Yeah, so in 3 years you expect to give feedback not only to the participating countries,
of course,
but also to all the other members of the association.
Of course, because it's true that we only have a few countries, but the results could be really precious for all our members. So this is something that is very important for us.
Okay, so we're in a pioneering phase. It's very hopeful, and we also have some big challenges ahead.
Yeah. As usual, I would say.
As usual. Okay, thank you so much for your time and your expertise. And thank you, listeners, for listening. For more information about Methylomic and other podcasts, please visit methylomic.eu.